Herpes zoster. Herpes zoster is a painful but self-limited dermatomal rash. It is also termed as shingles or zona. It occurs due reactivation of the varicella zoster virus. The predisposing or triggering factors which causes this reactivation of virus are immunosuppression, HIV, immunosuppressive drugs, radiation, malignancy, old age, alcohol abuse, dental manipulation, emotional and physical stress. The pathophysiology is as follows. Normally the host immunologic mechanisms suppress replication of the virus, but the virus reactivates when the host mechanisms fail. Once the virus is activated at the spinal root or cranial nerve neurons, inflammatory response occurs, leading to hemorrhagic necrosis of nerve cells, which causes neuronal loss and fibrosis. This causes neuronal necrosis followed by severe neuralgia. Then the virus travels down through the affected sensory nerve and causes dermatologic features. Clinical features is divided into three phases: prodromal or preeruptive phase or preherpetic neuralgia, acute eruptive phase and chronic phase. In prodromal phase there is presence of unusual skin sensations or pain or tenderness within the affected dermatome which heralds the onset of lesions by 48 to 72 hours. Pain in the form of burning, tingling, prickly, itching, boring, or knife-like sensations is evident. It is also associated with malaise, myalgia, headache, photophobia, and fever. In acute eruptive phase, vesicular eruptions are seen following the path of the affected nerve and terminate in midline. Cluster of vesicles on an erythematous base is the classical sign. The vesicles rupture, release their contents, ulcerate, and finally crust over and become dry. New lesions tend to form over a period of 3 to 5 days, and sometimes coalescing to form bullae. The patients remain infectious until the lesions have dried. The lesions will be associated with acute neuritis. The symptoms and lesions in the acute eruptive phase tend to resolve over a period of 10 to 15 days and require up to a month to completely heal. In chronic phase there is presence of persistent or recurring pain without rash or dermatomal pain termed as zoster sign herpes. Deep burning or aching pain is evidenced and take a long time to resolve to up to 12 months. Oral manifestations. Infection of trigeminal nerve causes unilateral skin and mucosa involvement supplied by the ophthalmic, maxillary and mandibular nerves. 1 to 4 mm vesicles or pustules, which rupture to form ulcers, are seen in the buccal mucosa, tongue, uvula, pharynx, and larynx. These vesicles or ulcers are seen unilaterally only and do not cross the midline. There is loss of taste sensation in the anterior 2/3 of the tongue. Treatment. Herpes zoster can be treated symptomatically with warm baths with soap and calamine lotion. Systemic diphenhydramine is given for pruritus. Acetaminophen can be given to reduce fever. But aspirin should not be given because it may cause Reye syndrome. Peroral antiviral medication like acyclovir and valacyclovir are given to reduce duration and severity. For post-herpetic neuralgia, tricyclic antidepressants, anticonvulsants and opioids are given. Herpes zoster can be prevented giving herpes zoster vaccine, Zostavax, to adults of 50 years of age or older to prevent shingles.